You can read the thing.
Okay, 60-year-old male with rectal bleeding, rectal examination revealed external hemorrhoids and fit 100. Colonoscopy and biopsy done revealed adenocarcinoma with melanosis coli. Histological examination of the specimen revealed a lesion invading up to muscularis propria. Patient has a history of chronic heart disease. How can you stage colorectal cancer and what is the stage of this? How can you stage colorectal cancer? They said TNF and Duke's classification. Uh,
And what is
and
the
the
stage
stage,
of this?
yeah, the stage of this, it's going through or invading the muscularis propria. Invading muscularis propria. It means it's B2, right?
It will be B1.
Are you
In
sure? Invading.
invading,
But
invading means
invade.
up to the muscularis propria. But if it penetrate, I mean, if it reach up to the see here in this picture, it is up to B1. Okay, not through the muscularis. Only the invading. Invading means it is only inside or entering into the muscle layer. But when it cross, then it will be through the muscle. Then it will be B2. I understood like that.
Mm,
It is B1. And
mm.
when it involves lymph node less than 3, that is 1 to 3, that is C1. And when it is more than 3 lymph node, that is C2. And distant metastasis is D.
So, yeah, so you are sure that invading means it is still in the muscularis propria. It didn't exceed.
Yes.
Okay, okay.
Okay. Now, what are hemorrhoids and how does they occur?
Uh, Hemorrhoids, this is engorged with anal cushions,
Mm,
right?
okay. Yeah, that is okay. And how does it
Okay.
occur?
How does it occur? The anal cushions are normally strengthened by fibromuscular fibers called Treitz ligament. And when this ligament fragments by by sudden stress or continuous stress and straining, like severe constipation for a long time, it will lead to that these cushions will become swollen and engorged with blood.
Yes, like that. Okay. What is the pathogenesis of thrombosed bile?
Yeah, sudden rise in the stress, in the sudden rise in the pressure will lead to a rupture of the microvasculature and will lead to a clot in the anal verge, and this will lead to thrombosed biles.
Okay. Define melanosis coli and what its significance.
Melanosis coli, it is a pathology of pigmentation of the colon, of the wall of the colon. It is it is discovered during the time of colonoscopy, um, and it has no significance with the colorectal cancer.
Okay. Why does coronary artery get thrombosed?
Why does coronary artery get thrombosed?
Yes. The answer also very funny type answer.
Why coronary artery gets thrombosed? Uh, why coronary artery gets thrombosed? What is this question? Why coronary artery gets thrombosed? I don't know.
Answer is atherosclerosis, due to atherosclerosis.
You're
So,
kidding or lie.
yeah.
This is the answer?
Yeah, this is the answer.
Oh,
This is the answer.
oh my God.
Okay, just we can remember if anyone
Yeah.
Yeah. How does atherosclerosis occur? What are the risk factors?
Oh, okay. How does atherosclerosis occur? What are its risk factors? Okay, atherosclerosis occur by endothelial damage, endothelial injury,
Mm-hmm.
and then wait, and then there will be yeah, platelet aggregation and activation. Then monocytes and smooth muscle cells will migrate to the lamina propria. Then monocytes will be activated into macrophages, and macrophages will start to engulf the lipids, and accumulation of lipids will transform it to foam cells. It's characteristic cell of atherosclerosis with release of inflammatory cytokines, and the last step will be proliferation of myofibroblasts and extracellular matrix formation.
Yes, very nice. So you just rapidly read it, right? But you said everything. Very
No,
good.
by the way, I put a cross on all the what is written in. Yes, I put a cross on all of this. Then I write steps
On your own.
with arrows, you know? Yes, then I put steps with arrows. I cannot يعني,
Yeah.
get all these informations. It's like, I'm
Yes.
not a machine. I cannot
Yes.
study like this.
Yes. Yes.
It should be steps so I can, يعني, in my mind, by the way, I put it in a draw. I draw like, yes, okay, the cell move from here to here, then
Yeah.
this will happen, then the lipid come inside and become foam
Yes.
cell. Then I
Yes.
remember the question of foam cells, you know, all came together. But if I'm studying like a machine,
Mm-hmm.
or in Egypt, we are calling it, you are a donkey. You are studying like a donkey because we are telling the donkey to go there, go home, he will go home. No, it's not like
Yes.
that.
Yes.
I'm
Okay.
trying to reach the Egypt. This is the best way.
Yeah, that is the best. And this is long lasting. It will stay in memory.
Exactly. Exactly. Risk factors we studied before.
Yeah.
Risk factors we have. I think when I said it, you didn't like it, so you told me it's modifiable and non-modifiable.
Yes.
Modifiable, yeah,
It is
modifiable
easy.
like genetic factors. See the meetings. So Allah is very important. Modifiable is the genetic factors, the family history. The non-modifiable is genetic factors and family history. And we have the modifiable will be smoking, male sex, age, hypertension,
Male,
diabetes mellitus, hyperlipidemia.
male sex.
Yeah,
Can
male
you
sex, yes.
modify this? Male
No,
sex.
no, it's not. I'm sorry. It's
Okay.
not modifiable. And age also modifiable, not modifiable. It should be age and male sex. Yes, age and male sex and genetic and family. And the
Yes.
modifiable will be the hyperlipidemia, hypertension, diabetes, smoking. Yeah.
Yeah, that is nice. Okay. What are the common site of atherosclerosis and their effects?
Yeah, anything will ask me about vessels, it will be moderate and large vessels.
Mhm.
You remember this? We have three questions in our pathology. Also, general cell arthritis
Yes,
and something else.
giant
I
cell
can't.
arthritis.
Yeah. Also, where in moderate and large vessels. Yes.
Hmm.
Type what is their effect? We have to give examples, right? So
Yes.
it will be like in coronary arteries, it will cause myocardial infarction. In the cerebral blood vessels, it will cause cerebrovascular accidents, and also in colon vessels, it will cause ischemic colitis.
Yes. And if it is in lower limb,
In lower limb, it will cause lower limb ischemia,
yes.
and yes.
In kidney,
In kidney, it will cause acute renal failure.
renal failure. Can you
Yeah.
define a thrombus? What is its function?
Thrombus, this is, yeah, thrombus, this is a product of the coagulation pathway, and it stays in its original position. What is its function? It is meant to stop the bleeding.
What's the mechanism of thrombus formation?
Mechanism of thrombus formation. Yes, we have injury of we have the endothelial injury and vascular constriction. This will lead to platelet aggregation and activation, and they will uh, uh, they will secrete thromboxane A2, and thromboxane A2 will secrete will lead to more activation and aggregation of platelets. Then will be fibrin clot formation with the help of activated factor 13.
Okay. Mention four difference between a thrombus and a clot.
Yeah. Thrombus is formed in a circulating flowing blood, but clot is formed in a static blood. Thrombus is friable and dry, but the clot is pliable, means it's flexible. Thrombus also has white and dark or white and red color, white and red lines. It's called lines of Zahn, but the
Hmm.
clot has the appearance of red currant jelly. The thrombus is attached to the wall of the blood vessel, but the clot is not attached.
Very good. Okay. Again, how does myocardial infarction occur?
Uh, how does myocardial function? Okay. Okay. So, atherosclerosis and narrowing, or atherosclerosis and thrombus in the coronary arteries. Uh, this will lead to ischemia of the myocardial muscles, and there will be a cessation of the anaerobic metabolism, cessation of the aerobic metabolism, and activation of the anaerobic metabolism and the accumulation of lactic acid. This lactic acid also uh, I'm answering now. I'm sorry, I'm answering now. I have to be honest. I'm answering from my like experience, from
Yeah.
what I read before. But I
Yeah.
don't know if it is what is written in the notes or not. I'm not sure. Is it the same? I don't
You,
remember what is
you,
written
you,
after that.
you touched the key some points, but I
Uh,
think there is little more they wrote. See
okay,
the
let's revise it
last
together.
answer. They started from the beginning and up to the consequence. Within the second of the
With
vascular
seconds of
obstruction, you can read.
mm, aerobic glycolysis ceases, leading to drop in adenosine triphosphate. Yes, this is very important. And the accumulation of potentially noxious metabolites like lactic acid in the cardiac myocytes. The functional consequence is the rapid loss of contractility, which occurs within minutes or so of the onset of ischemia. Ultrastructural changes, including myofibrillar relaxation and glycogen depletion, cell and mitochondrial swelling, also become rapidly apparent. These early changes are potentially reversible. Only severe ischemia lasting at least 20 to 40 minutes causes irreversible damage and myocyte death, leading to coagulation necrosis. How can we get all this? I read it many times, but I couldn't get it. So I left it. But I
But the way,
remember it's the very first thing.
but the way you started, I think the first paragraph that is enough. At least
And
if you can,
easy, easy. You know it
easy.
already.
Yeah,
Everywhere, what is ischemia doing? Aerobic glycolysis will stop and start lactic
and
acidosis.
yes, an anaerobic will start. That will leading to a further progression of the inflammatory process.
Yeah, but within second and within minute and
No
20,
need,
40
no
minutes,
need, no need.
but it's
We cannot
too
remember like
complicated.
yeah. Okay, you did well. It is good.
Thank
Okay. Okay. So this one I can take.
you. Okay.
Okay, it's 70.
Uh,
Mhm. Okay.
but this is what? This is colorectal cancer? Colorectal cancer, right?
Yes, yes.
Oh my goodness. I didn't read this one at all, but I will try, okay?
But you will know all the answer. While reading, I found it it is much more similar with our previous stations. You will see. A
Okay,
70-year-old man colonoscopy performed and showed rectal tumor. Biopsy was done showing adenocarcinoma. Okay.
okay. What are the features suggesting poor prognosis?
Okay.
Yes, I remember something very important is signet ring
Yes.
uh, cancer
Yes.
and something else. I don't remember. Maybe uh, it's an obstruction or
Yeah. Very. If we just
dissemination
keep
to
our mind
lymph
cool,
nodes.
then answer will come. See this.
Metastasis,
Yes.
it's poor prognosis.
Yes. You can also say also the cancer marker carcinomembranous antigen. If it is very high, it will say poor prognosis. So
Mm,
if signet cell carcinoma
mm,
will indicate worse prognosis than if the
mm,
carcinoma is in advanced stage. Also, if it is poorly differentiated and it
mm,
involve the surrounding structure.
mm,
Also, presence of ulceration and high CEA marker will indicate the poor prognosis. It is
mm.
easy. Then,
Okay.
what is the difference between staging and grading? Staging is the assessment of extent and size by the anatomical view, where grading is the growth and spread of a tumor in a pathological view.
Mm, okay.
Then, if the patient had a concomitant cancer at his anorectum, what is the most likely type or
Mm,
pathology? It will be a squamous cell carcinoma.
yeah.
And
What is the
resection,
pathology? It is metastasis? Mm. No. The pathology? What is the pathology? What does he mean? Ah, he's asking, yeah, I mean, what is it? What is the type of the cancer?
cancer
Mm,
type of
okay,
the cancer
okay.
will be squamous cell because the skin near the below the dentate line of the skin is the squamous epithelium as like the
Yes,
skin.
yes.
So the cancer also will be
Yeah.
squamous cell carcinoma. Resection has been done.
Yeah.
Only 1 out of 19 lymph node were involved. What is the N status? So N we know it is the number of the lymph node. If it is only involving one,
Mm,
so it will be 1A. The status will be N 1A.
okay.
Then a few months later, the patient developed hepatic metastasis with ascites. Ascitic tab show atypical cell. What pathological test will you do to prove the origin? We will do immunohistochemistry. We will do
Yeah.
immunohistochemistry. Differential diagnosis between immunohistochemistry and tumor marker. Immunohistochemistry is a method of identification of a specific antigen in a tissue or a body cell by antigen antibody. recognition process. Uh, and tumor marker is a protein which is found in the body and produced by either a tumor cell or by a healthy cell in response to a cancer. And what is immunohistochemistry in a simple word? The same. It is a method of localizing specific antigen in the tissue by antigen antibody recognition. How does it work? Uh, okay. Usually in the body there will be okay in uh, okay antibody is linked with the fluorescent dye, and when it is mixed with any body tissue, and if there is any specific antigen present in the tissue, then there will be antigen antibody reaction, and the color of the pH of the media will change. It will change the color. So by detecting the color change, we can recognize the presence of antigen. So this is how it works. What type of antigen antibody reaction in immunohistochemistry? It is a complement fixation test. How immunohistochemistry help in uh, dissection of chemotherapy? Uh, Immunohistochemistry give us idea about the cell and tissue which we need to target during chemotherapy. So with the help of this immunohistochemistry, we can plan for the uh, uh, target cell, and this is how it is effective in chemotherapy.
Okay, I think we can see it in a better way. Like immunohistochemistry helps to us to differentiate the origin of the cancer cells, and also it helps us to identify something very important in every cancer, like a receptor status in breast cancer. And this will help us in the decision of the treatment we will choose for each case. Like in breast cancer, if the cancer is estrogen receptor positive, we will
Mhm.
give her tamoxifen or anastrozole. If it is
Okay.
HER positive, we'll give her herceptin.
Yes. Yes.
Should be the correct answer.
Mhm. Yes. We can include those points also. So this is how it
Yeah.
helps in chemotherapy. Yes. Okay. Next one. How tyrosine kinase inhibitor works?
Yeah, I think the androgens is transferred to estrogen by
Yes.
tyrosinase or tyrosine, and this tyrosine kinase will inhibit this enzyme and inhibit peripheral conversion of
Yes.
estrogen. So,
Yes.
and estrogen is very important for the growth and development of the cancer. So that's how it will decrease the growth of the cancer and prevent recurrence.
Yes. That is the answer. Mhm. So 6 months later, the patient develops a large pelvic tumor. Is this patient at high risk of developing venous thromboembolism? Yes, he is,
Of course,
because of hypercoagulability, because it is already
yeah,
a malignancy, and due to the venous stasis, because of compression
yes,
by the tumor in the pelvic.
yes, yes.
Now, diagnosis of pulmonary embolism, complication of pulmonary embolism. Pulmonary embolism can be diagnosed by clinical examination, and also by reviewing the chest X-ray, also D-dimer, and uh, the gold standard for pulmonary embolism diagnosis will be CT angiogram, CTPA, and the complication of PE will be pulmonary hypertension, pleural effusion, cardiac arrest, arrhythmia, etc.
Look, very important, very, very important. It will go like there is embolus or thrombus in the one of main branches of pulmonary artery. So you will think about what? Pulmonary infarction, then pulmonary hypertension, then heart failure and arrhythmia. Heart failure,
Mhm.
very important. The heart cannot push against this big
Block.
blockage, so there will be for sure heart failure.
Okay. Pulmonary infraction, then pulmonary
Yeah,
hypertension, heart failure,
yes,
and
exactly.
arrhythmia. Yeah,
Yes.
good sequence. What is
Believe me, don't study like this. Put it in sequence and put it in your mind, you will remember. I'm not a good in recalling the data. You know, you think that I'm very good. No, no. You will if you found my answers, you will find my answers arranged.
mm-hmm.
Because if I didn't arrange it like this, I will never remember it in the exam with the stress. So you have to start from now to arrange the answer. I cannot study and recall and recall. No, no, it's very, very big data, very large data. I cannot recall all of this. But when you put it in order, believe me, you will remember it whenever. Yani, this station, I studied it a long time ago. But everything, I arranged it. I make a draw. I make a sketch. So that's how I remember it. Like the theories of the endometriosis. I studied them
Yeah.
many times from the book. I couldn't. Then I crossed everything and then I make my own draw. Wallahi, after this draw, I will never forget it. There is a one arrow coming from the fallopian tube. This is regurgitation. One arrow
Mm.
coming from blood vessel and lymphatic. This is the metastasis. And the metastasis. Under it, I wrote metaplasia. So metastasis,
Mm.
metaplasia. Like
Metaplasia.
this.
Yes.
And stem progenitor. خلاص, you will never forget. I even draw a bone besides the uterus to remember. Can you believe this? Believe me, if you follow this way, Allah, you will never forget.
Very nice method, brother. I should have learned this from the beginning, but
But you still
yeah,
have time. You still have time.
yeah.
Believe me. Just choose the most difficult topics and do this to them. Wallahi, you will be perfect. I promise you.
Thank you, brother. Whenever I talk with you, I get stimulation and I get little, I get some impulse.
Yeah, and
Okay.
like these theories, you will never forget them.
Yes. Okay. Now we can finish this one. Uh, okay.
What is the contents of blood thrombus and how it is formed?
What is the content of blood thrombus and how it is formed? In the blood, okay, thrombus. In thrombus, there will be aggregated platelet and there will be a red cell and they will form a plug. Also, there will be fibrin mesh or yes, fibrin linked fibrinogen uh, uh, mesh,
Like you said, yes, fibrin mesh or fibrin network. It's the same.
fibrin network. Yeah.
And circulating cells or admixed cells.
Okay. Okay. Then how to obtain plasma from the blood? Yeah. First, we withdraw blood sample and put it in a test tube and add anticoagulant. Then we put it in the centrifugal machine and we centrifugate it for the 15 minutes. Then in the lower part there will be red blood cell and in the upper part we will get the plasma.
Exactly.
Okay. Now malignant melanoma. You can read.
A patient known to have hypothyroidism with a hard swelling in the inguinal region, the GP sent her for biopsy. So, if the inguinal lymph nodes was lymphoma, what are the distinct types of lymphoma? Hodgkin lymphoma and non-Hodgkin lymphoma. How malignant cells survive in lymph nodes? We answered it yesterday or the day before. The malignant cells will secrete vascular cerebrous factor C and D, and this will induce lymphogenesis in the primary tumor or sentinel lymph nodes. Also, they secrete immunomodulators like exosomes, and this will lead to that's how they survive in lymph nodes.
Yeah.
And why is melanoma pigment? Because of the melanin. So,
Yeah, because of the melanoma.
yeah. Mention 4 types of melanoma. Yes. We have superficial spreading and superficial spreading melanoma, amylonotic melanoma, uh, acral acral and lentigo, and nodular, acral nodular and lentigo. Yes, ANL, acral nodular and lentigo. 3 methods of spread of lymph node or 2 lymph nodes. طيب, we have direct, even direct invasion of lymph nodes, or what is this? 3 methods of spread to lymph nodes.
The methods of spread of lymph node. I think it
And
is
he means
how,
spread of the cancer.
yeah, spread of the cancer, how cancer spread to lymph node.
Ah, this is the primary tumor is will cause direct invasion or direct spread without negative feedback or control,
Yeah.
and then these cancer cells will invade through the lymphatic vessels and embolize through lymphatic vessels. Then they will go through the circulation in lymphatic and lymph vessels and will settle in this distant location. Then these cancer cells will grow in the distant lymph nodes or the distant location.
Yes.
A lesion under the toenail was found, and the decision to amputate the toe and excise the lymph nodes was done. What is the objective behind this decision? Yes, because I want to prevent the spread of the cancer, also to reach a safety margin, and the toe already lost its function, and to control the pain.
Mm-hmm.
What is epithelioid melanoma? It is a type of melanoma that contain epithelioid cells, which is fused macrophages,
1 second.
and it appears.
Hello.
Oh,
Yeah, hi, doctor. You wrote? Okay. Thank you, doctor. Okay, I will pay. Don't worry. Okay. Thank you. Yeah, bye. Sorry, doctor. Please continue.
So the epithelioid melanoma is a type of melanoma that contains epithelioid cells, which is fused macrophages, and we can find this epithelioid melanoma in superficial spreading and nodular types of melanoma.
Okay.
What is a satellite lesion? This is a metastasis of the malignant melanoma that is usually found at a distant way from the primary tumor. Some sources say it's within 2 centimeters, and it is separated from the primary lesion, and it is believed that it is due to lymphatic spread and embolus locally.
gene mutation in familial malignant melanoma.
Yes, BRAF gene.
BRAF, BRAF, BRAF gene. Post-operative, the wound is red and swollen. Culture revealed diplococci. Give example.
Yeah, we have the gram-positive diplococci, Staphylococcus aureus, and Streptococcus pneumoniae, and Enterococci, and the gram-negative diplococci like Haemophilus influenza and the Neisseria meningitis. So how did I get them? These are the encapsulated bacteria, if you can
Yes,
remember
yes,
them.
yes.
Yes.
Y-
Yeah. So
Yes,
I put the
category
first one as strep,
after
of course, is
splenectomy.
positive.
Mhm.
Yeah. The positive, of course, strep is positive, and Neisseria and Haemophilus is negative. So you will add to the strep on the left staph and on the right enterococci. That's it.
Mhm. Your methods are actually very nice. Okay.
Yeah, I need to remember that. What should I do?
Yeah, you should start your own course.
Oh,
Okay,
wallahi,
after
I
after
was
after
thinking that.
after after passing, inshallah.
Inshallah.
We'll start. Yes. Okay. Next, the patient became toxic with rapid spread of the infection. What do you think the cause?
Because the patient became toxic and rapid spread infection. Yes, this would be necrotizing infections.
Exactly. We have less than 1 minute. So this is the next station. Up to here. Okay, I will send new